Good morning, everyone. We're going to allow just a minute for more people to join the call, then we will get started. Good morning, everyone. I'm Andrew Sorensen. I'm a spokesperson here at CU Boulder, and I'll be moderating today's call. Some quick housekeeping items before we get started. Throughout today's campus Q&A, we will be sharing informative links with you through the chat function at the bottom of your screen, so please be on the lookout for those. If you have a question for the experts on today's webinar, please use that Q&A function at the bottom of your screen to submit a question. You can start doing that now. We will do our best to get to all questions. If we do not get to your question, you can visit colorado.edu/COVID-19. Chat box will appear and Buff Info representative will be available to answer your questions in real time. If by chance we run out of questions prior to the end of the scheduled end of the webinar, we will end early. On today's call, we have Chancellor Phil DeStefano, COO Pat O'Rourke, Ann Schmiesing, Executive Vice Provost, as well as Catherine Eggert, Senior Vice Provost. We have Jennifer McDuffie, Associate Vice Chancellor of Student Affairs, Myrna Jacobson, Interim Chief HR Officer, Akira Bradley, Vice Chancellor for Student Affairs, and Roy Parker, Director of the BioFrontiers Institute, Distinguished Professor of Biochemistry, and a member of the Campus Pandemic Response Scientific Steering Committee. I will now turn it over to Chancellor DeStefano, who will get us started today.
Morning, and thank you for joining us today. These are difficult times for our CU Boulder community. I want to begin by sharing my utmost sympathy for every individual and family affected by the Marshall Fire. I want you to know that our entire community stands beside you right now with a listening ear and a willing hand. I'm encouraged by so many of you who've given supplies, money, time, and emotional support to friends, family, and colleagues who are hurting. Helping one another is the only way we'll get through this chapter. The combined crises of the most destructive wildfire in Colorado history and the recent pandemic surge required us to make changes to the semester start. This is not a decision that we made lightly, but we believe it's the best one. I understand the educational, financial, and emotional implications that going remote, even temporarily, creates for many of us. We have gathered administrators from various campus divisions here today to provide more information about the Marshall Fire recovery, the upcoming semester, and to answer your questions. I know so many of us are tired of instability, uncertainty, and heartbreak. But history shows us that even under terrible circumstances, humankind has the capability to be flexible, empathetic, and optimistic. Thank you all, and especially our students and families who've adjusted your travel schedules and your return to Boulder for spring semester, for your patience and for your understanding. I urge you to stay tuned for additional information and ways to help in the coming weeks. Thank you. And now I'll hand it over to our Chief Operating Officer, Pat O'Rourke.
Morning, everybody. Thank you for joining us, and I'm going to be pretty brief so that we can then get to your questions because we want to make sure we're giving you the right information that you need. Wanted to start by acknowledging that we all know people in the CU Boulder community who are among those who will have to rebuild their homes and their lives. I'm really grateful to those who have taken their time to care for others, And I'm really thankful for those who have taken on even more work as we provide time to those in our community who need to recover. I'd also like to thank our staff who have been coming to campus to support our community as we prepare for the spring semester. If you are one of the people who were impacted by the Marshall fires, please remember that there are emergency funds that are available for students, faculty, and staff, as well as administratively for those who are unable to return to their houses and need time to get back on their feet. From the main colorado.edu page, you can access resources on the fire that provide guidance how to access CU resources and community resources. It's fair to say that our community has experienced a lot of trauma over the last 2 years, and it's weighed heavily on all of us. From the pandemic to the King Super shooting and now the Marshall fires, you've all answered the call time and time again, and we thank you, and we know that flexibility is a key ingredient to get through these challenging times. And echoing what Chancellor DeStefano said, I wanted to take a moment to ask everybody in our community to be empathetic and responsive to the needs of our students, faculty, and staff as everyone navigates their own circumstances. Right now, it matters a lot to please be kind to each other and to be patient. The person with whom you're dealing may be taking on extra work because they're filling in for a person who lost a home or who is caring for a child at home who's sick with COVID. At the same time that many are recovering from the Marshall fire and its impacts, we're in the midst of the Omicron surge. Because of the impact of the fires on our staff and the Omicron surge, as Chancellor DeStefano described, we had to move to remote status for 2 weeks. I know this was a burden and a disappointment for many people, and I apologize that we were unable to provide more advance notice, but the fires were unexpected, and we couldn't return people to campus unless we were able to meet the needs of the community. But we're committed to returning to in-person instruction on January 24th, because we've heard from students across our community about how important it is for them to have the opportunity to learn in person and to participate in events across the campus. I do want to share a little information about what we're seeing in the Boulder community about COVID and how it plays into the decisions we made, including the decision we announced yesterday to update our vaccine reporting requirement to include boosters. You can probably see my screen, and I wanted to give you some data about what's going on within the community. You can see here that this is the historical graph of what happened in the community with COVID cases over the course of the past 2 years. And right now we're at the highest point in terms of COVID cases that we've seen during the course of the entire pandemic. When you think back to the fall of 2020, when we had the spike that affected the CU community so greatly, the numbers of COVID cases were less than half of what we're seeing in the community now. We know that this is a number where we're likely to reach peak infectivity soon, and then the numbers are going to go down. We can see that as hopefully we'll follow the same trend line that we saw in other countries that had an Omicron wave before us, including South Africa, where you can see a very high spike, much like the one that we're experiencing now, followed by a quick decline. But at this point in time, the number of cases is high. And we also know that our positivity rate in the Boulder community is high, so that there are a number of people who are being affected, and that led us to be able to conclude that we needed to start remotely in order to be able to transition back to campus and make sure we're able to offer essential services. What we know is that although the number of cases is high, that we're starting to see some increased hospitalizations within the community, but we're not seeing the same type of exponential spike. And one of the reasons for that is that the Boulder community is fairly well vaccinated, and that it's also picking up on receiving boosters. As you can see from this graph, there's been very good booster uptake in the Boulder community generally, with most of the boosters having occurred in the more elderly population. This also corresponds with what we already know about our own community, which is that about 2/3 of our faculty and staff have already received boosters, and we really need everyone else to get on board and to be able to get their boosters as quickly as possible. The reason why is that they matter. This is a graph that has recently come out from a study showing that for people who have been boosted compared to people who have just gone through an ordinary course of vaccination, showing that the rate of mortality is about 80 to 90% less. Our goal is to be able to minimize the healthcare burden in our community, to be able to keep people safe, and to make sure that we're doing what we can to ensure that we're able to continue with the continuity of in-person instruction once we return to campus. Our booster requirement means that all faculty, students, and staff must upload proof of a COVID booster by February 24th, or 5 months after receiving the final dose of the original series, whichever is later. We're providing boosters through Wardenburg Health Center and have hundreds of appointments available each day that you can book through the MyCU Health portal. The student, faculty, and staff must upload proof of boosters or file for an exemption based on medical, ethical, or moral grounds through the MyCU Health portal. And those individuals who previously submitted an exemption don't need to take any further action at this time. They will be considered in compliance with current university reporting requirements. Over 92% of our campus community members received the original series of vaccination, and your dedication to getting both vaccinated and boosters enables us to be successful. We're confident that this requirement, in conjunction with our other COVID mitigation measures, will allow us to proceed with our in-person experience this semester. And now I'd like to turn to Dr. Roy Parker, Distinguished Professor and Director of the BioFrontiers Institute, who's a member of our Pandemic Response Scientific Steering Committee, to make a few remarks about the science that's driving our COVID decisions. Roy? Andrew, do we have Dr. Parker?
We do.
I'm sorry. I want to thank everyone for joining us, and I just want to, point out that this is a scary time with so many cases of Omicron in our community. But I also want to point out that this is exactly what we expect as the pandemic evolves and we move to a more endemic form of COVID. That as we all progress in our immunity through vaccinations and prior infection, we will have less severe disease when people get infected, and the virus will continue to evolve to form new variants, which are better at transmission and which can escape our immune response. And that's exactly what we're seeing with Omicron, a new highly infectious variant which partially escapes prior immunity, either from infection or from vaccination. And because of that, we're in this we're in this wave of Omicron infections that Pat has talked about. And I don't want to reiterate a lot of what Pat already said, but we should expect many cases in Boulder County and at the university, but a large proportion of those cases will be asymptomatic or mild. And this is because there's very clear data that vaccines and boosters provide excellent protection from severe disease from Omicron. We should expect a strain on our healthcare system because there are a fair number of unvaccinated people still in Boulder County. And Omicron is so infectious that we should expect that most of those people over the next few months will be infected with Omicron. I want to point out there's some things we don't know. As Pat mentioned, we think the peak is going to be in late or mid to late January. But that's really difficult to predict because we all adjust our behavior as cases increase. We become more isolated and we reduce the rate of transmission. But I think a reasonable guess is late January will peak. And then the real question is, how fast does the peak come down? As Pat pointed out, South Africa has showed very rapid decline of cases. The United Kingdom and Denmark have been showing slower signs of decline from their peak of infection. Although the good news there is the United Kingdom pace of decline is starting to pick up, suggesting they might also have a rapid up and down. So we don't know. It could be that we come down from that peak very fast, or it could take a few months. What we recommend, of course, is that you are vaccinated and boosted, and vaccines are available on campus. We recommend you improve the masks you wear. Wear an N95, or if you don't have an N95, double mask with a cloth mask on top of a surgical mask, or double surgical mask. Cloth alone gives very inadequate protection against Omicron. Obviously, if you have symptoms or been exposed, get tested and isolated until you're sure you're not infected. And if you have symptoms, regardless of any test, or if you test positive, stay home. That's just good public health to limit spread of not only COVID or Omicron, but other infectious diseases. And then, the final thing I want to point out is a highly vaccinated community. We are in a good position to get through this Omicron wave with less impact than previous waves of COVID infections, because the vast majority of cases are going to be mild and not require a severe intervention medically. I do want to point out, of course, we're very worried about children under 5. These are more susceptible because they're not eligible for vaccines yet, and older and immunocompromised adults who have an intrinsically higher rate of severe disease. And if when you're in any of these categories, I think you should try to take as many steps as possible to protect you and your family from infection. And I just want to end there and emphasize that this is the way we're going to be for the next 10 years, that there's going to be each wave of new infections and vaccinations will increase our total immunity. Because of that will increase the severe disease, because there'll be crossover between infections and new variants in our immune responses. And that, our hope, of course, is that Omicron may be the last big wave and we have less severe disease, and therefore we can move on to a better place. And I'll stop there and we can move on.
Thank you, Roy. First, I want to echo the chancellor's and Pat's thanks to our faculty, staff, and students and their families for their patience and perseverance following the Marshall Fire. We know this is an extremely difficult time for our community right now. What I'm covering here today will be provided to our faculty and academic support staff in a lot more detail as an academic instruction guidance update tomorrow. So please look for that message from Senior Vice Provost Catherine Eggert. It will be sent through the Deans, Chairs, and Directors listserv. This updated instruction guidance can also be found on the Academic Affairs website. It will be posted there, and that will be in the Academic Planning and Assessment section. When the campus returns to in-person teaching and learning on January 24th, classes must be offered in the instruction mode listed when student registration began. So that is, faculty cannot independently change their in-person class to being taught remotely for the rest of the semester. All of us are aware, of course, that instructional faculty might need to have shorter periods of time away from the classroom this semester because they're ill or quarantined or because they've been impacted by the Marshall Fire. So this semester, we're emphasizing flexibility of instruction for instructional personnel who are ill, quarantined, or displaced. And the academic instruction guidance that's coming out tomorrow will cover how, in those cases, chairs, directors, and deans will have the discretion to work with their instructional staff to make sure that instruction is covered, including teaching remotely for a short period if that's appropriate. Likewise, we're guiding our faculty to offer substantial flexibility for students who are ill, quarantined, or displaced. We really need all instructional personnel to exercise compassion and flexibility regarding assignment deadlines, attendance policies, and the like. So we're making a twofold ask for faculty to be as generous and patient as they can be with requests, and for students to be upfront about their needs. So we ask all faculty and other instructional personnel to read the instructional guidance that will cover all the particulars of how this will work. And again, that will be sent tomorrow. And finally, we know there are a lot of accommodations and adjustments to make as we proceed over the first few weeks of the semester. We are so grateful for everyone's flexibility, for your patience, for your support. And Catherine Eggert and I are happy to take your questions during the Q&A session. And I'll now turn it over to Andrew to open the Q&A.
Thank you, Ann, and thank you to all of our panelists for their insights today. We want to give you all the maximum amount of time to ask your questions. Again, if you have a question, please put it in that Q&A function at the bottom of your screen. We're going to start off with a question for Roy Parker. Has CU considered natural immunity? This person asks, if I can show a positive COVID result, will that be acceptable as an exemption? I, like many people, recently contracted the Omicron variant despite being vaccinated, this person says. I do not understand my need to get a booster or protect our community from this variant when I have the best way to protect myself and others, natural immunity.
I think, Andrew, this might be a question appropriate for Jennifer.
Sure.
Thank you, Dr. Parker. Yes, that is a lot of really good information. And one of the things that I would say is, in order to safeguard our campus and our broader community, we want to make sure that this policy applies to everyone. And so seeking medical advice in the direction of our medical team on campus, we do encourage boosters as long as a person is not currently infected and having symptoms. And we also always encourage individuals to work with their primary care providers. If there is a reason to make a medical exception, we do have a process in place to support that.
Great, thank you. Jennifer, we're going to stick with you, and Pat may also have some information on this one. This person asks, given the prevalence of breakthrough infection, what is the university's guidance regarding in-person work or study during this Omicron surge for high-risk faculty, staff, or students, those who are immunocompromised, pregnant, caring for young children, or have immunocompromised dependents?
So I'll jump in on that, which is that is something that is not amenable really to be able to say there's a campus policy that can address every situation. For those people who have a particular susceptibility or circumstances where they believe that it would be not feasible for them to be able to work on campus and need remote work, that they should approach that with their supervisors to be able to discuss those circumstances and to be able then to work with HR in order to make sure that their unique needs are met.
Thank you. Question for Anna or Catherine. What's the likelihood of resuming classes as scheduled? I assume they mean in-person classes.
I can jump in on that one, and Anne can supplement anything I have to say, which is that we intend to begin classes in person on January 24th as planned, barring any extreme emergency that we do not foresee at this time. That is the plan, and our faculty and staff who support our academic mission are gearing up to do exactly that.
All right. Another question for Pat here. This person asks, will the Supreme Court ruling on the OSHA mandate have any effects on CU's path forward?
No, those are unrelated. One of them deals with just the authority of the federal government to be able to use some of its regulatory authority to be able to address workplaces throughout the United States, but it doesn't have any effect upon what individual employers like the university need to do in order to be able to protect its own community. So the Supreme Court's decision will not impact our pathway forward.
All right, thank you. Question for Jennifer McDuffie and Akira. I and other students are suffering, this person says, as far as mental health right now. I understand switching remote for 2 weeks because people unfortunately lost their homes, but we are anxious that CU intends to stay remote for the entire semester. Is there some way to ensure us of CU's intention to actually be in person. And I think Catherine Eggert partially answered that question, but Jennifer and Akira, perhaps you want to take the opportunity to talk about student mental health support.
Thank you so much. I think Catherine Eggert said it. I think Pat said it. We are very much committed to an in-person experience. And we know that we have a lot of our students, as well as our faculty and our staff, that are suffering. They are lonely and isolation, whether that be for COVID or whether it be in a remote setting, has not always been the best avenue for their health. And so we do have our services available to students right now. We have a variety of those services, whether that's student support and case management, if you're concerned about a friend, if you're concerned about yourself, or it's going directly to our counseling and psychiatric services, our victims assistance, or if you're a faculty or staff member, our faculty and staff assistance program. We also recognize that for a lot of folks, stress, change, all of those words are really compiling right now at the beginning of a really tough start to the new year. And so whether you're looking for skills, whether you're looking for a place to come and talk with other people, or whether you're looking at programming just to meet new friends or to get out, we will be offering all of that as much as we can virtually, but also in person once the semester starts in person on the 24th. Dr. Bradley, did I miss anything?
No, ma'am.
Okay, well, thank you to both of you. Jennifer, we're going to stick with you for a second. This person asks, are you requiring students that are only taking remote classes to get the COVID booster?
This is a really interesting question, because if a person is a degree seeking main campus student, they are required to get the booster or to follow any of our policies and guidance. And so I think that if a person is questioning, well, I'm taking remote classes or I'm taking online courses, but I am pursuing a degree, then the answer is yes. And if you have any questions about that, please reach out to our Buff Info team and we can have that personalized or individualized conversation.
Thank you. Question here for Anne. This person says, I'm surprised and disappointed that professors continue to execute classes online after being 2 years into the pandemic. With the cost of this education, how does the university and its faculty determine which classes go online and which ones do not?
Thank you for the question. So with regard to how we determine which courses go online versus an in-person or a hybrid modality, those factors for making determinations like that can include pedagogical aspects. So, the discipline and the feasibility of teaching the content online. Also, it can at times include factors such as the number of sections. So, for example, departments offering multiple sections of the same course at times will offer one or more of the sections online as a way to offer students flexibility.
And then kind of following up on that, Catherine, do you have the latest data on how many of our classes are in person scheduled this semester?
Yes, so 93% of our total classes for the spring semester are in person. For undergraduate classes, that figure is 95%. So we are offering very few of our classes remote, online, or hybrid remote this semester. Almost all are in person.
Great, thank you for that clarification. Question here for Pat. What about staff who are fully remote? Why are you requiring us to get boosted if we aren't ever on campus?
So it's partially the ability for us to be able to administer the requirement. The other thing that we're finding is that the number of people who end up being fully remote is relatively small. that for the majority of people, even if they are normally working in remote status, there are times where they may need to come to campus in order to be able to meet with a supervisor, to be able to attend some type of meeting. And because of the nature of the employment that most of our university employees engage, making this requirement applicable to all of our employee populations makes the most sense and allows us to be able to administer the requirement most fairly.
Thank you. Another question for Jennifer. This person asks, how long does it take to get a moral ethical exemption on the vaccines? And what is considered in approving these? How do students or parents get notified of the approval or disapproval?
So currently, it takes us what we say is about 7 to 10 days. And the reason why we say that is during peak time, especially around deadlines, we do get an influx of information, and we want to make sure that we review that. It is something that we do verify, and we take it very seriously. In terms of reviewing for any kind of moral or ethical, we are going to rely solely on the person who is submitting that. We are not going to question what those beliefs are, but to ensure that they have completed the requirement. And if there's any questions or any follow-up needed, we will communicate directly with the person submitting that. So if it's the student or it's the employee, we do not at this time communicate with anyone outside of the person who is submitting the information on their behalf.
Thank you. Another question, Jennifer and Anne, you might each have a piece of this. If the university plans to return to in-person instruction on January 24th, the booster requirement on February 24th leaves our community unprotected, or underprotected rather, for a full month. Given the highly contagious character of Omicron, shouldn't we delay the in-person instruction to correspond with the booster requirement deadline?
So why don't I take this one? I don't believe that that's appropriate. What we are seeing in our population is that we have a highly vaccinated community, and the boosters, even though we are going through an Omicron wave, they're helpful, but that delaying instruction further, given the way that our community needs to be able to return to in-person instruction in order to be able to maintain academic continuity, and the fact that for the vaccinated population, that the symptomatology for Omicron is relatively mild. Having the booster requirement come into play provides additional protection, but I don't believe it would be a situation where we need to delay the beginning of an in-person instruction until the booster requirement becomes fully effective. It will help our community be more protected over time, but isn't necessary in order for us to be able to return.
Thank you. And Pat, we're going to stick with you for this next question. Will the campus mask mandate be lifted soon, since the booster is now a requirement?
No. And there's a couple reasons for that. First, Boulder County itself is still continuing with a masking requirement, and we are really trying to be in sync with what Boulder County is requiring. We've also found that in our classroom settings, in order to be able to protect faculty, staff, and students, that it's important for us to be able to maintain that as a requirement. And so we're going to continue that until we see the rate of infection within the general community drop to a level where it would be something that we can reevaluate. But I want to decouple the masking from the boosters, because one does not eliminate the need for the other.
All right, thank you. Question here, and Pat, you may each have a component of this. This person's asking, does CU plan to host a graduation ceremony for the May 2020 graduates?
For the May, what we plan to do is have recognition for the May 2020 graduates in the commencement that we're planning for the upcoming period. But I don't think it would consist of a separate commencement ceremony. All
right, and another question for potentially Pat and Ann. Will CU Boulder students receive a decreased price in the cost of tuition due to being forced to take online classes? This person says it's well known and documented that virtual learning is less expensive, hurts students' mental health, and hurts students' ability to succeed.
Ann, you want to take it?
Sure, I'll take it. What we are doing is reducing room and board rates and also prorating other fees to account for the 2 weeks of remote instruction and operations. And so the fees that are location-based that will be prorated by 10% are the athletics fee, the operating portion of the rec center fee, bike program, and a transit pass. So those are the reductions that we are making to fees and room and board rates, but not to tuition.
All right. Pat, anything to add there?
I think Ann got it at the end, which is that no, we're not reducing tuition, that we're only going to be in remote status for 2 weeks before transitioning back to in-person instruction, and all of the cost to be able to support in-person instruction, including of the faculty and the services that we support, remain, notwithstanding the fact that we have a brief period of time that we need to be in remote status.
All right, thank you. Question here for Jennifer. This person says, on the MyCU Health patient portal for faculty and staff to provide proof of vaccination, this person says there are no instructions for those of us who received the J&J first and then received the Moderna vaccine for a booster. Would you please provide some feedback indicating what we should do?
Yes, I submitted my information yesterday on the MyCU Health portal, so this is very good timing. If you were someone who received the vaccine or the booster through medical services here at Wurtemberg, then you do not have to do anything. There's nothing that you need to submit. We already have your information. But for one of my shots, I actually went off campus. And so if the person who's asking the question got Johnson & Johnson, on the vaccine compliance screen, there are a few different fields, and it'll have Moderna dose 1, dose 2, dose 3, Pfizer 1, 2, and 3, and then J&J 1 and 2. You would put the dates in the drop-down menu. There is a calendar if you prefer to do it that way. The dates of the 1 or 2 boosters, or excuse me, 1 or 2 shots in this example, and then upload a picture of the immunization card that you received. And once you hit submit, like I said, it'll take us about 7 to 10 days to verify. And if there's any information or any questions that we have, our team will be in touch.
All right, thank you. Question here for, I think partially for Pat and some for Ann. This person's asking, recent communications from CU regarding changes to campus operations have provided little information about implications for staff. Can the panelists speak to the unique implications of operational changes and expectations for staff versus faculty and students, and commit to providing communication that is directly relevant?
So I'd be happy to take that. And I'm looking, Andrew, I froze for a second. Am I audible?
Yes, we can hear you.
Okay, sorry about that. Zoom froze on me for just a second. So I'm sorry that if the person who is receiving this and submitted the question felt like that we haven't been communicating adequately with staff. We've tried to make our communications applicable wherever we can to the whole community so that people understand what's happening. For staff, though, we're really in a situation where we need that communication also to be coming from their individual supervisors in their own units, because the way that switch to remote status impacts staff may be different than it impacts students, because if learning is taking place remotely, faculty and staff are remote. But we also know that many of our staff have to still perform duties on campus even when remote instruction is occurring. So that it's harder to be able to have universal communications related to staff and changes in operating mode. But I will commit and work with HR and others to make sure that we're trying to provide as much information in a timely manner to staff as possible.
All right, thank you. A question for Jennifer here, and perhaps Roy, you have some insights here too. This person asks, how does Omicron affect the student body more than the seasonal flu? Why is there panic regarding the positivity rates?
Well, Roy, do you want to start or you want me to kick it off?
Well, why don't you go ahead, Jennifer?
So I'll take maybe what we're seeing at medical services and then turn it over. The question about, if it's the seasonal flu, we are actually seeing really a lot of flu, upper respiratory infections, and a lot of co-occurring strep and COVID, flu and COVID. I think that's there's a new term out there circulating about flu-rona. One of the things that I would say though, and I think that this is a really key point, is that the reason why the symptoms may be seen as mild is because of vaccines. It's because of boosters. It's because of the filtration and everything else that we're doing to help keep our campus safe. And we want to continue to see those milder symptoms. Obviously, we are still monitoring, and Dr. Parker can share a lot more of the severe disease. Who is it infecting? How long is the duration? And then how many of those diseases lead to hospitalization? And I think one of the things that we often grapple with on a college campus is that for the most part, we have a traditional age population of 18 to 24 when you look at our students. But that's not always necessary when you look at our faculty and staff. And we want to make sure that we're being not only healthy and safe within our community, but also with those that we interact with on campus and within the community. So we really need to decouple positivity rates from hospitalizations and severe disease. And I know Dr. Parker will probably talk more eloquently about that.
I would just add a couple comments to what Jennifer said. I think, the question really is, why are we worried about this so much if some of our students don't get very sick, if vaccinated individuals don't get very sick? And I think, this is a difficult decision for the university to require boosters or not, and what policies to make. There are widely divergent opinions in the community as to whether we should have more COVID restrictions or less COVID restrictions. And, one of the rules of COVID is you can't make everybody happy. So I think we've tried to hit what we think is the best decision to try to minimize risk so that we can function as more close to normal as possible. There are arguments on both sides of all these decisions, but I think the presence of vaccinations and boosters minimizes severe disease as much as possible. And I think that's where we have to try to be as a university community.
All right, thank you. Question for Pat, Jennifer, or Roy. I had a bad reaction to the booster shot. This person says, I'm not sure I'll be getting any additional shots anytime soon. And they ask, at what point are we not going to require additional boosters, especially for those who are having adverse reactions?
So I wish that I could answer that question, Andrew. We don't know what COVID is going to do. We don't know what recommendations for future boosters are going to be, and we don't know what the progression of the disease is going to be in the weeks, months to come. What I'm hopeful is that as these waves continue and vaccines, boosters, and immunity becomes more prevalent, hopefully the disease burden will become less, and we won't need to be in a position where we're requiring boosters in the future. But I can't make that commitment because I don't want to make a prediction about what a disease will do and end up being wrong about it. We've stated from the beginning that what we're going to do is we're going to follow the science and work with our science team in order to make the recommendations that are best for the campus. And like Dr. Parker and Jennifer McDuffie were just saying a moment ago, even if the symptomatology is somewhat mild in our student population, the risk that we have is that if we don't do things that are protective for the community, it will lead to those increased burdens on the healthcare system and end up in situations where others are pressuring us to move away from in-person instruction and not to be able to offer the services that we want to be able to offer on campus. And so we're taking these actions to try to both protect the community and to protect the educational experience that people are receiving. And so our goal is to be able to do what's best for our community.
Thank you. Question here for Akira and Jennifer. Will CU isolate students in residence halls who have COVID as they did in the past?
Thanks, Andrew. So with our current campus vaccination and booster requirements, we have not designated space for isolation during this academic year. We will work with our students who test positive to ensure they understand the CDC guidance for isolation and quarantine procedures in their homes, including in their residence hall rooms or apartments, whether they're on campus or whether they're off campus. And our campus continues to have an indoor masking requirement, which is current emphasis in reducing the spreading of Omicron.
Thank you. Question here for Jennifer. If we got our booster at Wardenburg, do we still have to upload proof?
No, you can consider your requirement complete. We will take any booster or vaccine that was completed, distributed at Wardenburg, and make sure that your account is updated accordingly.
Thank you. Question for Pat and Jennifer. This person says, we're hearing that cloth masks are no longer sufficient protection and that we should utilize N95 or similar masks. Will campus have plans to make these masks available for faculty, staff, and students, either at cost or for free?
The answer I can give on that, Andrew, is that we're responding to that, the latest on that as well. We're working with our folks to be able to procure N95 masks where we can, but that we're also working on getting a supply of surgical masks, which also seem to be protective and bringing those to campus. We're working through the procurement process on that right now. And so we want to be able to make those available as quickly as we can. But we also hope that people will also purchase masks where they can and be able to protect themselves as we work through the procurement.
Thank you. Another question for Pat or Jennifer. Do you feel regular testing of frontline essential services employees is appropriate right now?
The short answer is no. That what we're doing is we're continuing to provide diagnostic testing for faculty, staff, and students through Wardenburg. We have the capacity to do several hundred of those tests per day and turn those around within 24 hours. But the Omicron variant behaves differently than the variants that we were testing for before. And due to the way that this particular disease spreads, surveillance testing would need to occur really frequently, 2 to 3 times a week, and with a really high participation rate to have any real impact on the university community. That's beyond what our surveillance testing capabilities would have been during the 2021 school year. And instead of using a testing strategy that really isn't likely to be of much benefit to the university population, we want people to get tested when they are symptomatic or when they have reason to believe that they are affected by the disease, but that we really need to lean upon what are our best practices, which is the vaccination, the boosters, masking, and respect for others in order to be able to best protect our university community.
Thank you. Question for Akira, and this does get to staff, so perhaps Pat has some insight here, but for Akira, are there any university housing options for those who are displaced by the fire, faculty, staff, or students?
So we are working to support our residents who needed housing with the delay to in-person classes and our undergraduate and graduate students who were displaced from the fire. We've reached out to all of those students directly to provide resources and support as they're available.
Thank you. And perhaps this is a good time to plug on the fire resources page. If you are impacted by the fires, there are some options on there for community members who need short-term rentals and things like that. Question here for Anne and Catherine. My question's related to in-person requirements for staff, particularly academic advisors and coaches. Asking these staff members to work with students in a one-on-one setting will unnecessarily increase exposure to transmission of COVID-19 for students, faculty, and staff in the greater Boulder community. This person's asking, is the campus going to reevaluate this requirement for the spring semester?
So I'll start, and Catherine chime in. Advising modes and hours too are determined by supervisors within the advising system. So similar to the question and answer regarding online modalities and how we determine which courses are online or taught in person or in a hybrid mode. These determinations are going to be made by supervisors according to student success needs, whether advising is in person or some of it offered via remote. But as we return to in-person modality, we are going to be having those in-person support services as well. Catherine, do you want to chime in there?
Nothing to add. Thanks, Anne.
Question for Pat and Jennifer here. What's the criteria for holding in-person indoor events on campus, whether they're large or small, before the return of students, faculty, and staff on January 24th?
I can start us off and Pat can jump in if I miss something, but we want to make sure that we are able to support our faculty, staff, and students who may have been impacted by the Marshall fires. So during this time for events, we're going to really leave it up to the venue and the event space specifically, but also the event guests to determine if they have the staffing and infrastructure to support the event, and then also to work with our UMC events team. Once we're on campus in person on the 24th, we do ask that everyone follow the event and guidance protocols and policies. And at any point, if you have questions, please reach out to the UMC events team or to Andrea Zelenko, who I think many of us know very well and can help answer questions. Pat, did I miss anything?
No, Jennifer, thanks.
Question here for Pat. This person says, as a parent of children too young to be vaccinated and whose job can be remote with no impact to the student experience, as long as these numbers remain in record-breaking levels, shouldn't folks like me stay remote even beyond this 2-week period?
So I'm going to fall back on the guidance that I gave before, which is that during this period of time, that if people can work remotely, then that's appropriate. But that people need to be working with their supervisors to be able to discuss their circumstances, as well as to be able to discuss what the workplace needs are. It would be inappropriate for me to jump in and say, yes, go ahead and work remotely, because I don't know that employee's individual circumstances, nor do I know what the work requirements are that are for that particular person. But I would encourage both supervisors to be flexible and to allow that, if it's possible, for that remote work to occur, and for employees to be really candid about what their circumstances are with their supervisors, so that those needs can be balanced and we can make sure that we're meeting the needs of our students, faculty, and staff on campus where appropriate, but also not putting people at a perceived risk if it is possible for the work to be done remotely.
Thank you. And a question more directed towards the fire chancellor, perhaps if you can give us a little bit of a sense, a question here about those who are outside of Colorado, what were the impacts of the Marshall Fire on the campus community, and how did that play into this decision on a 2-week delay?
The Marshall Fire did play into our decision to go remotely for 2 weeks. That along, obviously, with the sizable increase in the number of COVID cases. The Marshall Fire affected faculty, staff, and students. Over 60 of our faculty and staff completely lost their homes. A very significant number of faculty and staff and students have been displaced. And because of the fire, some of them have not been able to move back to their homes because of water issues, because of issues that need to, that need to be cleaned from the standpoint of damage to their homes. So we did have to take that into account because of the serious nature of the fire and the impact that it had on our community. So together with COVID, that was the main reason why we delayed in-person instruction for 2 weeks.
I just add one other thing there, which is that at the time we wanted to make that decision and give people as much notice as possible. When the evacuations were occurring, we knew that over 700 of our community members were affected. And the most important thing that we needed to be able to do is if we were going to return to campus for in-person instruction is to make sure that we would be able to have people be able to staff the residence halls, be able to staff dining, be able to do the things that allow us to have people return and both be successful and safe. And so we needed to make a decision, provide people with enough notice, and then be able to have a period of time to be able to transition back to in-person instruction. And we're going to be ready to make that transition in about a week and a half.
Thank you. Question here for Jennifer. This person says, my son is a student at CU Boulder and is vaccinated, but ended up getting COVID over winter break. Does he still need to get a booster by the deadline, or should he get it a little later?
Thank you for the question. We are going to ask that everyone adhere to the deadline, faculty, staff, or students. And for this family, I'm hopeful that your student is feeling much better and is working with their primary care provider if appropriate. If their primary care provider doesn't feel at this time that a booster is necessary or not encouraged, we do have a medical exemption process. But if not, we can accept boosters as well as exemption forms to be submitted by the deadline of the 24th.
Thank you. Question here for Pat. There are some people not wearing masks on campus or putting masks on when you walk into their office. My understanding is that it can linger in the air. So why isn't CU requiring masks 100% of the time while working in CU buildings?
The short answer is that first of all, when people are in settings where the masking requirement applies, that people should put their masks on. But if somebody is working in a private office, we've recognized that the possibility of transmission is low in those circumstances if they're working alone, and that they should be in a position where they recognize, though, that when they're interacting with others in those public facing settings, that's the appropriate time to mask up.
Thank you. And this will be our last question of the day. And I think potentially several administrators may have something to say here. This person's asking, will students who've enrolled prior to this booster mandate be fully refunded up until the February 24th deadline if they choose to not receive the booster vaccine or submit a waiver?
So I'll take the answer to that question. And currently, any student who wants to withdraw has until January 26th to do it and would receive a 100% refund minus a $200 fee. So the dates are available for that. But I would hope that the person who submitted that question would be thinking about it and saying, okay, if I don't want to get a booster, think about applying for an exemption. We want to be here to be able to offer education, to be able to help people advance towards their goals, and to make sure that at the same time we're doing what we can to be able to protect our community. And those things can all occur if we're working together. And I'm really extraordinarily grateful for what this community has done over the course of the past year, and what I know what the community will do over the next weeks and months to come to make sure that we're able to be successful, to be able to offer in-person instruction, and to be able to have students work towards their degrees, graduate, and begin their careers. So the community has done a tremendous job of being able to support us, and I can't tell you how much I appreciate their willingness to continue to help us during this time of need.
Thank you. And thank you to all of us for joining today. We want to thank you for your compassion during these hard times, as well as your caution. If you have further questions or you'd like to see additional information, you can do so by visiting our COVID-19 website, colorado.edu/COVID-19, and our fire resources page, colorado.edu/fire-resources. We'll now end the call. Thank you all for joining.